So in this position, we have Sarah in a plank position. This is an isometric contraction. Her feet are also in dorsiflexion. Her shoulders are also in flexion at a 90-degree angle, and her erector spinae are engaged to keep the head in line with the spine. The muscles that are stabilizers in this position are the abs, glutes, and the erector spinae.
During the transition from plank to downward dog, the shoulder joint comes from flexion to extension, and the hip joint comes from extension into flexion. Also working is the agonist, which are the glutes and the hamstrings pulling into a different position. The glenohumeral joint is in an isometric contraction to avoid going into either elevation or depression. All the muscles in this transition are voluntary.
The final position we will analyze is downward dog. In this position, the feet are still in a dorsiflexion. The body is also cut on a transverse plane at the hip joint. The hamstrings in downward dog are in an eccentric contraction, and the hips are in a concentric contraction. The transversal spinal muscles are working to avoid a kyphonic curve in this position.
Now with this anatomical knowledge, you can take it and use it to make a perfect plank in your next jazz class.